Okay, so the hepatic portal system or hepatic portal circulation. It is the circulation of blood between your gastrointestinal tract and the liver. Okay. Uh, when you will hear the term portal circulation or portal in the circulatory system, that indicates the circulation between two sets of capillary beds. So here you know the capillary bed is formed by the capillaries. So this is one set of capillary bed and this is another set of capillary bed here. So two sets of capillary beds are connected by a blood vessel. So this is one capillary bed, this is another capillary bed and connected by a blood vessel. That is the portal circulation. Portal circulation connects two sets of capillary beds. Now, I told you hepatic portal circulation is the circulation between the gastrointestinal tract and the liver, right? So one set of capillary bed is in your gastrointestinal tract and another set of capillary bed is in your liver. Okay? Those two are connected by the portal vein. We'll see in the picture later. Just know that this is called portal circulation, when two sets of capillaries are connected by a blood vessel. Yes.
Are there more than the one that's just between the GI tract and the liver?
In the GI tract, there are many capillary beds. In your liver, there are many because those are laws of structures, right? So two sets of capillaries, beds. That is the portal circulation. Now, the question is, why this circulation is important in our body? The reason is, you know that GI tract indicates your stomach, small intestine, large intestine, right? The food, after we eat the food is taken, nutrients are taken into the blood, right? And the nutrients should be taken to the liver from your GI tract. From your intestine or stomach, the food nutrients will be taken to the liver, because liver is the main organ in our body where metabolism takes place. You know that liver is the main organ for metabolism, right? So nutrients must be taken to the liver. So the hepatic portal circulation will collect the nutrients from the gastrointestinal tract and will take the nutrients to the liver. That's the hepatic portal circulation. Okay? So the capillaries in your gastrointestinal tract will absorb the nutrients and then will take to the liver. So now, which blood vessels will collect the nutrients from those parts of GI tract? You already know the main vein in your stomach is the gastric vein. Gastric indicates stomach. In last class, I told you in case of arterial system, the main artery in your small intestine, upper part of the intestine, is the superior mesenteric. Do you remember that? Mm-hmm. And from your lower intestine, inferior mesenteric. So gastric from the stomach, superior mesenteric mainly from the small intestine, inferior mesenteric mainly from the large intestine. Okay? They will collect the nutrients from those three organs, three parts, and will drain the nutrient-rich blood into the hepatic portal vein here. You see gastric, superior mesenteric, inferior mesenteric, superior mesenteric, inferior mesenteric. They will collect the nutrients and will drain the blood, nutrient-rich blood, into the hepatic portal vein, and that vein will take the blood into the liver. Okay, to the liver. So that's the hepatic portal circulation. Now we'll talk about the capillaries. First, we'll talk about the structure of a capillary. Then we'll see different types of capillaries present in our body. Classification of capillaries. Then we'll talk about the capillary bed, difference between artery and vein. We have talked about that before. Then we'll talk about the blood pressure and regulation of blood pressure. Okay, so those are the things we'll talk now. First, the structure of a capillary. If you see the wall of a capillary wall is extremely thin, formed by a single layer of endothelial cells. A single layer of endothelial cells, and endothelial cells rest on basement membrane, connective tissue membrane. So that's the wall of the capillary. A single layer of endothelial cells rest on the basement membrane. And we know that through the wall of the capillaries, exchange of gas, nutrients and metabolic waste take place. So from the blood, the nutrients and oxygen enter into the tissue, right, through the wall of the capillary. And from the tissue, the metabolic waste enter into the blood, and carbon dioxide also enters into the blood. So through the wall of the capillaries, the exchange of gas, nutrients and metabolic waste take place. And other blood vessels, your arteries, vein, what is their function? Transportation of blood, right? I told you before. The veins and arteries transport the blood, and capillaries are the blood vessels through which the exchange takes place. Okay? Okay. Usually, capillaries get connected to each other and form anastomos to each other and form network. That is called the capillary bed. Usually, the capillaries get connected to each other and form capillary bed. And the lumen size, lumen is the opening inside the capillary, right? The passes through the capillary. The lumen, the diameter of the lumen of a capillary is smaller than the diameter of a red blood cell. So the diameter of the lumen of a capillary is smaller than the diameter of a red blood cell, and you know that one important property of red blood cell is they can squeeze and pass through because they are flat, right? So they can get folded. You remember I told you that they can easily get folded and pass through the narrow capillaries, and that's why the red blood cells are able to pass through the lumen of the capillary, although the lumen size is smaller. And that is very important because you know that if the capillary diameter was bigger than the diameter of the red blood cells, if these are the red blood cells, now you see many red blood cells will not get attached to the wall of the capillary directly, right? Will flow to the blood. But since the diameter of the capillary is smaller than the red blood cell, what happens? The wall of the red blood cell touches the wall of the capillary, and that is important because the exchange of gas easily takes place because the wall and of the capillary and the wall of the red blood cells get touched to each other, contact to each other. That is very important. Okay. So all red blood cells will be able to participate in the exchange of gas. And at one time, only one red blood cell will be able to pass through, not more than one. Okay, now we'll see different types of capillaries present in our body. Three types of capillaries are present. What are those? Continuous capillaries, fenestrated capillaries, and sinusoidal capillaries. Okay. In this part, two things are important: the structure of those three types of capillaries and in which locations you will find those capillaries. I will ask those two. Okay. Structure of three types of capillaries and in which areas in our body we will find them. So first, the continuous capillaries. The endothelial cells are connected by tight junctions. we know that the wall is formed by a single layer of endothelial cells. So endothelial cells are connected by tight junctions. Intercellular clefts are present. Cleft, the term cleft, have you heard that? Cleft? You have heard cleft palate, cleft lip. That means gap, right? Gap between two. So intercellular clefts, that means in between the cells, the space or gap is present, and through which those gaps are very narrow, so through which only the fluids and the small molecules will be able to pass, because the clefts are narrow. Only small molecules will be able to pass through. Locations. You will find plenty of continuous capillaries in your skin and the muscles. Okay? Also, you will find the continuous capillaries in your brain. But remember that the continuous capillaries in your brain are different than the continuous capillaries in your skin and muscles. What is the difference between the capillaries in your brain and the capillaries in your muscles and skin? The wall of capillaries, continuous capillaries in your brain has holes, but those holes are much smaller than the holes in the continuous capillaries in your skin and muscle. Okay? So now, if I see the skin or muscle, this is the wall of your capillary. There are many clefts or holes like this. In your brain, if you see the wall of the capillary, the holes are there, but they are much smaller. Make sense?
Yes.
Much smaller. This is your brain, the wall of the capillary. This is the skin or muscle. So that is the difference. Yeah. Now, why is that? You know that brain is the most sensitive, delicate organ in our body, right? Your brain is the most delicate and sensitive. So, because of the small holes in the wall of the capillaries, many chemicals will not be allowed to enter into the brain. Make sense? If the holes are bigger, then many chemicals will easily enter into the brain. But we don't want that, because chemicals can cause harm to the brain. Brain tissue is very sensitive, very delicate. Okay, so that's why the wall of the continuous capillary in the brain is different than the wall of the continuous capillaries in your skin and your muscle. And now, the wall of the capillaries in your brain is called the blood-brain barrier. Probably some of you have heard that, but you didn't know probably what is that. Blood-brain barrier, or BBB, blood-brain barrier, is nothing but the wall of the continuous capillaries in the brain. Okay? And what's the purpose? The purpose is preventing many chemicals from entering into the brain tissue. Okay? Specially designed the wall of the capillaries in your brain. Okay? Now, you know that we take medicines, right? All the time we take medicines, and all medicines have some harmful side effects, right? Harmful chemicals are there. So, if all those medicines enter into your brain tissue, that can cause harm to your brain tissue. That's why it is very important that we have that blood-brain barrier. Now, the problem is, when you need the medication for your brain, the manufacturers, the pharmaceuticals, they have to know that, right? Mm-hmm. If they make the drugs, the molecules are bigger than these holes, what will happen? It will not enter into the brain. So they have to take special measures to make those molecules that can enter into the brain, pass through these holes. Okay, that is important.
What type of drugs are those? Are like antidepressants and stuff?
Yes, those are very good. Many drugs block the neurotransmitters inside the brain. Okay, so if you see the structure of a continuous capillary, you see here, I told you that in between the endothelial cells, the clefts are intercellular clefts are present. But those clefts are very narrow, okay, compared to other capillaries. So intercellular clefts are present, but those are narrow clefts through which the fluid and small molecules only can pass. Fenestrated capillaries. Fenestrated capillaries, if you see the wall has clefts, and those clefts are larger than the clefts of continuous capillaries. Number one. Number two, if you see the endothelial cells, interestingly, if this is the endothelial cell, this is another endothelial cell, in between the endothelial cells, we have the intercellular clefts. Okay? Also, through the cells, some holes are present like this. If you think that this is the endothelial cell and pass many tubes through the cell from one side to other side, then the fluid can pass through those tubes, right? So from one side to another side. So in between the cells, endothelial cells, we have clefts, and those clefts are larger than the continuous capillaries cleft. Also, through the endothelial cells, there are many pores or holes passing from one side to the other side. It's just you can think that you are passing many narrow tubes through the cells, and through those tubes the fluid can pass. Where you will find the fenestrated capillaries? You will find the fenestrated capillaries in those structures where absorption, secretion, and filtration, those three functions are performed. So in those organs where what happens? Absorption, secretion, and filtration takes place. Absorption occurs where? In the intestine. Example, right? Secretion occurs in the glands, and filtration occurs in the kidneys, right? So in those organs, you'll find the fenestrated capillaries.
Did you say the cells are smaller or larger than the other one?
I didn't say anything. Cells, the size of the
Not
cell.
cells, but I'm sorry.
The clefts.
The clefts.
Clefts are larger, and also the endothelial cells have many through passages. Okay. Yeah, but you did not see in case of continuous capillaries, the clefts are narrower and no holes or pores through the endothelial cells. Okay. So which one will be more permeable? Continuous or fenestrated? Fenestrated, yes, definitely. Okay. You see here in the picture the clefts, and also these are the endothelial cells and many pores through the endothelial cells. Sinusoidal capillaries. Larger intercellular clefts and usually fenestrated. And the clefts are so big or large that the blood cells can also pass through it. So large, very large intercellular clefts and usually fenestrated. And the clefts are so large that blood cells can also pass through it. And where you will find the sinusoidal capillaries, you will find the sinusoidal capillaries in the liver, in the bone marrow, and spleen. Why? You have to think that. Why you will find the sinusoidal capillaries in those organs? You know that. If I ask you what's the primary site for red blood cell production? Bone marrow, right? And after the red blood cells are produced, they must enter into circulation, into the blood vessels, right? So through the wall of sinusoidal capillaries, they can enter into the blood easily. What are the sites for destruction of red blood cells? what are the graveyards for red blood cells? Spleen and liver, you know, right? So the red blood cells, old red blood cells can get out from the blood vessels and enter into the liver and spleen, and the macrophages will destroy them. So that's why in those organs you see the sinusoidal capillaries. If you see the picture here, you see the intercellular clefts are very large, very big, and also fenestrations are present, and fenestrations are also large. So very porous wall. Okay, so you got three types of capillaries. There is structure and locations. Okay. Now we'll talk about the capillary bed. Capillary bed is formed by the anastomosis or networks of capillaries and located between the terminal arteriole, the last arteriole, smallest artery, and the venules. So in between the terminal arteriole and venule, the capillary bed is present. Okay? And the flow, how much blood will flow into in the capillary bed is controlled by the precapillary sphincters. Many sphincters are there, and those sphincters control the amount of blood that will enter into the capillary bed. Now, if the sphincters are constricted, then what will happen? Less or more blood will go there? Less blood, because constricted, right? If the sphincters are dilated, more blood will enter into the capillary bed. So, who controls the sphincters? Sphincters are controlled by chemicals and nerves. So, two types of control, nervous control and chemical control. Here you see the capillary bed in between the terminal arteriole and venule. So this is the terminal arteriole and this is the venule. In between, this is the capillary bed. Okay, formed by many capillaries connected to each other. And now, the blood vessel that connect the terminal arteriole and venule directly, see this one, and runs through the capillary bed. That direct blood vessel, blood is going from the arteriole directly to the venule, that is called mapped arteriole. So mapped arteriole is the blood vessel that directly connect the terminal arteriole and venule, and blood directly can go from the terminal arteriole to venule without passing through the capillary bed. So that is the mapped arteriole. But from the mapped arteriole, blood enters also into the capillary bed, and the sphincters, precapillary sphincters, are located there, where the mapped arterioles deliver the blood into the capillaries. Okay? That area has the precapillary sphincters, where the blood enters from mapped arterioles into the capillaries. And those sphincters, you see the upper picture is showing that the sphincters are dilated, open, so blood is flowing into the capillary bed, Now the lower one, they have shown that the sphincters are constricted. So strong constriction can even stop the circulation into the capillary bed. So no blood is flowing in the capillary bed, only the blood is going from the terminal arteriole to the venule through the mapped arteriole. Okay, so that's the capillary bed and how the blood flow is controlled.
Professor,
Yes.
what would be the advantage of cutting off I mean, I'm thinking trauma, but what would be another advantage to cutting off the circulation to the bed itself and just having the meta-arterial being, you know, being the thoroughfare for the blood?
Physiological condition? Physiological, you're talking about physiological condition.
Well, what's the advantage? I mean, why?
Okay, so just think that if your blood pressure increases, okay, then in some areas, if too much blood enters into your brain or some capillaries in your brain, then that can, more blood into the capillary bed means more fluid can get out from there, right? So in that case, your body will want to circulate less blood through the capillary bed, okay? So in that case, the chemicals can, or nerve control can cause the constriction of the capillaries. But most of the cases, remember that the control is less or more, not completely stopping the circulation, okay? If too much blood is flowing in that organ, more than we need, then what will happen? You know, homeostasis, right? That will cause the constriction of the sphincters. To reduce the amount of blood that will go into that area. But the purpose, there is no real purpose of stopping the circulation completely. Then the tissue will not get any nutrition or oxygen, right? So that's in real situation inside your body that shouldn't happen. But you can cause that, like many research are done. If you cut a capillary and keep alive in a petri dish, right, and put some chemical that causes the constriction of the smooth muscle of the sphincter, and if you can strongly contract the smooth muscles, that can completely stop the circulation. But in our body, that shouldn't happen. But experimentally, we can do that. We can stop the circulation.
Yeah, but if you were out in the cold and you were slowly freezing to death, your body would constrict the external capillary beds to keep the core organs. So
yes, in that situation, all the blood vessels will contract because the smooth muscle will contract, right? And the sphincters can contract. If it's really cold, freezing cold, then that can do that, and that will kill the person probably, right? Or for a while, if it happens like for minutes, then the person will survive. But if it continues, then the person will not survive.
yeah, but it's better to lose your fingers and your toes than you lose your whole life, you know?
Yeah, they can die, that kill the tissue there, yes. Yeah, that is very good. Anything that will cause the smooth muscle contraction will cause the contraction of the sphincters, because the sphincters are nothing but the smooth muscle structure.
You said the blood enters the arterial from the precapillary sphincters, and where does it go to?
Blood enters from the arterial. Blood can directly go from the arterial to the venule, right? To the meta-arterial, and blood also will enter into the capillary bed, capillaries of capillary bed, and those areas are controlled by the sphincters. The differences between arteries and veins, we have talked about that before. I'll quickly go over. The wall of the artery is thicker than the wall of a vein, while the muscle layer is thick in the artery. The smooth muscle layer is thick. Now, since the wall of an artery is thicker, the lumen is smaller because wall occupies a lot of space, right? So the lumen, that means the opening, is smaller, and since the wall is thick, the lumen is round also because it will stay open, right? Because the wall is thick. Now, in case of vein, the wall is thin and the diameter of the lumen is larger because wall is thin. But since the wall is thin, if the blood flow is less or no blood, then the vein will collapse easily, will look flat, okay? The lumen is not round, but flat and irregular. Those are the anatomical differences. Now, if I ask you, tell me a couple of physiological differences, you can also tell. What's the function of an artery? Artery?
To take oxygenated blood.
In systemic circulation, arteries carry oxygenated blood, right? Take the blood away from the heart. In case of vein, systemic circulation veins carry deoxygenated blood and brings the blood towards the heart. You can tell inside the artery the pressure is high or low than the vein.
Artery?
High, because close to the heart, right? Heart pumps the blood into the arteries, not into the veins. So the pressure of blood inside the artery is high, pressure of blood inside the vein is low. You can add those differences. If I ask you, tell me anatomical differences, physiological differences, So here you see the artery, the wall is thick, lumen is round and small. In case of vein, wall is thin, lumen is bigger but flat. Okay, now we'll talk about the blood pressure. What is blood pressure? Its name is telling you what is blood pressure, right? It is the pressure of blood, where blood is inside the blood vessels. Right? So the definition of blood pressure is it is the pressure of blood, or it is the pressure given or exerted by the blood on the wall of the arteries while the blood circulates inside. So the pressure given by the blood on the arterial wall while the blood is circulating inside it. Make sense? So that is the blood pressure. Now, we measure the blood pressure. Usually, we measure the blood pressure from the large arteries close to the heart. But nowadays, you know that you can also measure the blood pressure from the fingertip, right? But is the pressure on the wall of large arteries same as the pressure of your small arteries in your finger?
No.
Not at all. How you measure the pressure from the fingertip? Because we know one thing, that what is the difference? How many times the difference is? How many times the pressure here is smaller than the brachial pressure? If you know that factor, how many times, then after you measure the pressure here, your device will multiply that, right? So that's how we can do. But usually we use the brachial artery. We measure the blood pressure from the brachial artery, which is close to the heart. Okay. Why blood pressure is important for us? Blood pressure is important to move the blood inside the circulatory system. Blood must move, right? Otherwise, blood will not go to the distant areas, far areas. If there is no pressure, if blood pressure is low, you know that blood will not reach to everywhere in the body. So the pressure keeps the blood moving, number one, and sends the blood far from the heart. So that's why the pressure is important. So maintaining normal blood pressure is very important. Now, what are the different types of blood pressure we get from the body? There are 4 different types of blood pressures. We measure systolic pressure, diastolic pressure, pulse pressure, and mean arterial pressure, or MAP, mean arterial pressure, or MAP. Systolic and diastolic, these 2 pressures we measure directly from the arteries. So these 2 are direct measurement from the arteries. And the pulse pressure and mean arterial pressure, those 2 pressures we calculate from the systolic and diastolic pressures. Okay? Now, definition. First, the systolic pressure. Systolic pressure is the maximum pressure on the arterial wall during the contraction of the ventricle. We know that when the ventricles will contract, the pressure inside your artery will be highest, right? Because blood just enters into the arteries. So systolic pressure is the maximum pressure on the arterial wall during systole, or contraction of the heart. contraction of the ventricle is called systole. Diastolic pressure is the minimum pressure on the arterial wall during the diastole or during the relaxation, okay, of the heart. So when the heart relaxes, blood comes back into the heart, right? So less blood inside the blood vessels. So the pressure will be less or more? Less, right? Because blood has already returned into the heart. So minimum pressure during the diastole or relaxation, that's the diastolic pressure. Pulse pressure is the difference. We measure it by subtracting the difference between systolic and diastolic. So very simple. If your systolic pressure is 120 and diastolic is 60, what will be your pulse pressure? What will be your pulse pressure? 60, right? Yeah, because it is the difference between systolic and diastolic. Mean arterial pressure is diastolic pressure plus 1/3 of your pulse pressure. So now you tell me, your systolic is 120 millimeter of mercury. That's the unit of blood pressure, millimeter of mercury. Millimeter of mercury. Your systolic is 120, your diastolic is 60. What will be your pulse? 60 millimeter of mercury, the difference between these two. Now what will be your MAP, mean arterial pressure? Diastolic plus
1/3.
1/3 of pulse is what?
20.
So your
80.
MAP is 80 millimeter of mercury. Okay. So those are the 4 types of blood pressure. Just know here that why we need to know the mean arterial pressure. The mean arterial pressure is an important indicator of what? How much blood your organs, like your kidneys, your stomach, your liver, your intestine, those pancreas, those organs are getting. How much blood your organs are getting, that is indicated by the mean arterial pressure. Okay. Now, the factors influence the blood pressure. You know that there are many factors that influence the blood pressure, right? We say don't eat this, don't eat salt, don't do this, don't, like many factors. But 3 factors directly influence the blood pressure. What are those 3 factors directly involved in blood pressure in our body? The cardiac output or CO, peripheral resistance or PR, and blood volume. Okay. So now, what is cardiac output? Cardiac output is the amount of blood ejected from the heart in 1 minute. In each minute, how much blood comes out from the heart? That is what?
Cardiac output.
Cardiac output. How much blood gets out from the, pumped out from the, or ejected from the heart in 1 minute. That's the cardiac output. If your heart pumps strongly, then the cardiac output will be more or less? More. If the heart pumps strongly, more blood will come out, right? In 1 minute, more blood will come out, right? Exactly. So, when more blood comes out, that means more blood will enter into your blood vessels, right? So the pressure will be higher. More blood in your artery means the pressure on the wall is higher. Okay, so directly related. Peripheral resistance. This one indicates the resistance given by the wall of the blood vessels. By the wall of the blood vessels. Now, if there are 2 arteries, okay, one has lot of elastic fiber, another one doesn't have elastic fiber. which one will have less resistance in the wall? The elastic one, elastic,
The
one,
elastic,
right? Because it will dilate and will take the, reduce the force, pressure. Make sense? If it can dilate, it can absorb the pressure. Okay. So the peripheral resistance is the resistance on the in the wall of the artery, and that depends on the elasticity, how much the artery can expand. If the artery has less elasticity, the resistance will be more. Okay? If the artery here is more elastic, the resistance will be less. Is it clear? Okay. So that is the peripheral resistance. So if I ask you which one is directly related to the heart, which one is directly related to the blood vessels, condition of the blood vessel. Cardiac output is directly related to the heart. And peripheral resistance is directly related to the condition of the quality of the artery, wall of the artery. Okay? But both are directly related to the blood pressure. Both are related to the blood pressure. If cardiac output increases, blood pressure will increase. If peripheral resistance increases, the blood pressure will increase. So we calculate the blood pressure. Blood pressure equals to cardiac output multiplied by peripheral resistance. When we multiply those two, that is the blood pressure. Okay? So now you know what is blood pressure, you know what is cardiac output, you know what is peripheral resistance. Now, cardiac output, can you define it, anybody? It is the amount of blood injected by the heart in 1 minute. Now, in 1 minute, your heart does not contract only once. It contracts usually 70 to 80 times, right? Just think that your heart is contracting 70 times. So 70 times, by 70 times contraction, how much blood is coming out? You have to add 70 times, right? So that is the cardiac output. So then what is the amount of blood that comes out from the heart in one contraction? That is called the stroke volume. So stroke volume is the amount of blood, stroke volume, stroke, you know that, right? Stroke volume. Stroke volume is the amount of blood that comes out from the heart in one beat, one contraction. Is it clear? So this is per contraction, one contraction. And cardiac output is what? In 1 minute. Now if your heart beats 70 times, that means 70 contraction, right? So we can say that cardiac output equals to stroke volume multiplied by heart rate. Does it make sense?
Yes.
Because stroke volume is the amount coming out from the heart in one contraction, and cardiac output is in 1 minute, and your heart is beating 70 times, right? So cardiac output, you have to multiply it by 70. In 70 times, how much blood is coming out total? Okay, so that's the cardiac output. You can get the cardiac output by multiplying the stroke volume and heart rate. Now, peripheral resistance is the quality of the wall of the artery, right? Quality of the artery, wall of the artery. Now, can you tell me a couple of conditions? The wall of the artery, the quality of the wall of the artery, tell this. One is age. When we get older, you will see that usually young people don't get high blood pressure, usually. Older people get hypertension, right? High blood pressure. The reason is the elasticity of the wall of the artery reduces, gets decreased. Okay? That's why peripheral resistance increases. Peripheral resistance is more in older blood vessels, wall of the older people. Okay? So that increases due to age, one factor. Another is it can increase in young people too. When if you eat too much, what?
Facts.
Fat. Fat does what? Accumulates in the wall of the blood vessels, arteries, like this. Okay, and will change the elasticity of the wall of the arteries, number one. Number two, when the cholesterol will accumulate there, the diameter of the lumen will do what?
Decrease.
Decrease. The lumen will be narrow. If the lumen is narrow, the pressure will be more. Okay? So, the cholesterol can decrease the elasticity, number one, because some fat is there. Number two, can decrease the diameter of the lumen, so the pressure of the blood will increase. Okay? So those are two very common factors. They can change the peripheral resistance and increase the blood pressure, yes.
I'm a little confused. If the lumen is smaller, then the blood flow is more?
Blood pressure, no, blood flow is less, the pressure
Right.
will be more.
Blood
Like just think
pressure,
that you
okay.
have two tubes, same amount of blood you are trying to pass through tube. One is narrow, one is wide.
Okay,
Like sucking a soda through a straw versus a coffee stir.
Yes.
right, got it.
When you are gardening, you are giving water to your garden, you know, if you make the tube narrow, then the
I got it.
pressure will
Thank
be
you.
more, right?
Thank you, I just
Yeah. No, no,
got
no.
mixed up.
Okay.
What is that? That is stroke volume times what? What is HI?
Heart rate,
Okay.
how many times your heart is contracted. Okay? Heart rate. Okay.
So we should say that peripheral resistance is affected by age, cholesterol, and fat in the diet?
Fat is the cholesterol. Cholesterol is the fat, one type of fat. Okay. So those are, so if I ask you which one is related to the wall of the blood vessel, that's the peripheral resistance, right? The cardiac output is the force of contraction of your heart. If your heart contracts forcefully, cardiac output will be more, right?
Yes.
Stroke volume will be more. Okay. Now,
What about blood volume?
blood volume. That is very simple. If the volume of blood is more, there are two persons. One has more blood in the body, another person has less blood. More blood means inside the arteries, the blood is more, right? So, if the blood is more inside the artery, the pressure on the wall of the artery will be more, right? So, that is very simple. If the volume of blood is more, the pressure will be more. If the volume is less, the pressure will be less. So, if I take some blood out from your body, your blood pressure will go up or down?
Down.
Down, because the volume will decrease. Okay? There is no chance that it will go up. Okay, so those are directly involved in
So,
blood pressure.
so if like, let's say your blood pressure is a little bit high, does it mean that when you donate blood, the pressure will go low?
If you have less blood in your body, the pressure will be low.
But
That is called hypovolumic hypotension. Hypo means less, volume, hypotension. Hypovolumic hypotension is less blood related low blood pressure. If you lose blood, then pressure will go down.
But when you donate blood,
Done?
when you donate blood, does your pressure go down?
When you
Temporarily, yes.
when you donate, you say when you donate blood, that's why they will ask you to drink water or fluid, because immediately it will not go down because you have some controlling system in your nervous system and endocrine system that will try to maintain the blood pressure. So the like 1 liter blood donation will not decrease the blood pressure because the controlling system in your body will try to increase by causing vasoconstriction. Okay, blood vessels, if the blood vessels are constricted, blood pressure will go up, right? So your nervous and hormonal control will
Try to stay there.
lift the blood pressure a little bit up, and by that time your body fluid will increase, you will drink or eat, right? So it will come back to normal. But if you donate like 5 liter, then no way. You have total like 5 liter blood.
I think I know what you were you wondering if donating blood would be a way to normal, like if you have high blood pressure, can you make your blood pressure normal by regularly donating blood? Is that what you were kind of wanting to know? Is if you can fool your body into becoming closer to a normal range?
That is one way, but it might not work if it is related to the peripheral resistance or something else. If it is only related to hypervolumic hypertension, that means your pressure is high due to increased amount of blood. In that case, it will work. And that's why sometimes if the pressure is high, you will see the furosemide or Lasix, right? That emergency doctors will give that to produce more urine. That means it will reduce the volume of blood, fluid, water will come out from the blood, okay? But that might not work all the time because only if it is related to hypervolumic hypertension.
If you have high cholesterol,
No.
you know, that those constricted blood vessels are constricted, you know.
Right. So if it is related to that, then it will work. If not, then it might not work. Okay, now the regulation of blood pressure. We have 2 types of regulation, short-term regulation and long-term regulation. Okay? Short-term regulation is controlled or regulated by nervous system and endocrine system. So neural and hormonal. You know that endocrine means hormonal, right? So neural and hormonal, short-term regulation. If your blood pressure goes down suddenly, your nervous and endocrine systems will quickly try to fix that, okay? Another regulation that works slowly, that is called the renal regulation. That is the long-term regulation, slowly, much slower than the nervous and hormonal, okay? The short-term regulation is usually done by changing the blood vessels, peripheral resistance, altering the peripheral resistance, like if the blood pressure increases suddenly, then your nerves will tell the wall of the blood vessels to dilate immediately. Dilatation of the blood vessel will occur, so the blood pressure will go down. Make sense? So the pressure on the wall of the artery will go down. If your blood pressure goes down, your autonomic nerves will tell the wall of the blood vessels to contract. Sympathetic, parasympathetic, autonomic nerves. They will cause the constriction of the blood vessel, and that will increase the blood pressure, right? So, direct effect on the wall of the blood vessels. The long-term renal regulation works by producing urine, less or more urine. That I told you. If you can produce more urine, the blood pressure will go down. If you can reduce the urine production, the blood pressure will go up. Neural controls operate here. Reflex arcs that involve the baroreceptors, vasomotor centers in the medulla oblongata, and vascular smooth muscle. So those are 3 components of neural reflex. Okay, so let's see how that works. First, the baroreceptors. What are the baroreceptors? Do you know the term? Have you heard the term baro?
Yes.
Baro means what? Barometer. Barometer does what? Pressure. Good. So baro means pressure. Okay. So baro indicates pressure. So inside some blood vessels of your body, you have baroreceptors. They can detect what? The change of pressure. Okay? So where those receptors are called baroreceptors. Pressure receptors. They are located where? Located in the aortic arch. You remember aortic arch? Okay, good. So in the wall of the aortic arch, you have the baroreceptors. And then from the aortic arch, you know that 3 arteries, right?
Yeah.
Do you remember that?
Mm-hmm.
Good. So 3 arteries. And brachiocephalic trunk, common carotid, left carotid, left subclavian, right? So we have common carotid. And common carotid divides into what?
Yeah.
Internal and external carotid, right? At that location, where the common carotid divides into internal and external carotid, at that bifurcation, division, the baroreceptors are there. At the bifurcation of the common carotid artery. At the division of the common carotid artery. And that area is called carotid sinus. This area. Okay, this area is called the carotid sinus. Little bit wider here. Carotid sinus. So just know that in the aortic arch, bifurcation of common carotid artery, that location, and large thoracic and neck arteries. So those are the locations where the baroreceptors are present. And they detect the change of pressure. Okay? They will be activated when the pressure changes. Make sense? Then the medulla oblongata of your brain, you have vasomotor centers. The vasomotor centers. Vaso indicates what? Blood vessels. Okay, blood vessels. So what's the function of this center? It will control the blood vessels, right? Motor control. It will control the blood vessels. And then the wall of the blood vessel, you have the smooth muscle. We know that the wall of the blood vessel has smooth muscle. So what will happen? You see here how the control system works. If this is normal blood pressure, okay, normal homeostasis, blood pressure is normal. Now if the blood pressure goes up, this is the bifurcation of common carotid. They have just from one location. So baroreceptors will be activated, right? The blood pressure is high, so baroreceptors will be activated and will send signal to the vasomotor centers in your medulla oblongata, in your brain. And the vasomotor centers will then send the signal to the blood vessels, to the smooth muscle of the wall of the blood vessels, right? And will tell to dilate or constrict. What will reduce the blood pressure? Dilatation or constriction? Dilatation. So your vasomotor center must tell the blood vessels to dilate to reduce the blood pressure. Okay? So that will decrease the blood pressure. Also, your brain will send signal to the heart directly and will tell the heart to contract less forcefully, because forceful contraction means more cardiac output, right? Stroke volume is more blood will enter into the blood vessel. So if it reduces the force of contraction, that will decrease the blood pressure. Okay? So to reduce the cardiac output, the brain will tell the heart to decrease the force of contraction and also decrease the heart rate, because you know that cardiac output equals to what? Stroke volume
Times heart rate.
times heart rate. Do you remember that? So you can decrease the heart rate by reducing the stroke volume. That means force of contraction of the heart, as well as by reducing the heart rate. If you reduce the heart rate, the cardiac output will go down, right? So,
Please continue before I ask
Yeah.
you.
okay.
How can you reduce the volume that the heart is able to, I
That's a
understand
good
reducing
question,
the
yeah.
heart rate, but I don't understand how you can make the heart pump less blood.
The total cardiac output will go down, okay? Cardiac output in each minute, right? So if you reduce the total volume in each minute, that will reduce the blood pressure, because we know that the blood pressure equals to cardiac output into peripheral resistance. We are talking about this only, okay? So if the cardiac output goes down, the blood pressure will go down.
Oh,
Okay.
Okay,
That's
so
the
you mean
relationship.
drop the heart rate, not drop the volume?
Correct.
If you tell it to pump less
Right,
often.
by
it's-
dropping the heart rate, yes.
Okay,
So anyone, right? Decreasing the heart rate or decreasing the stroke volume, you can decrease the cardiac output.
correct.
And if you can decrease the cardiac output, doesn't matter what mean, the blood pressure will go down. Okay, blood pressure will be less. The opposite thing will happen if the blood pressure goes down. Okay, so in that case, vasoconstriction will occur. Blood vessel, your brain will tell the blood vessels to contract, constrict, so the blood pressure will go up, right? Increasing the peripheral resistance, and heart rate, force of contraction will increase. So the cardiac output will increase, okay? Another type of receptors are present in those same arteries, aortic arch, carotid sinus, or bifurcation of common carotid and large arteries of neck. Those receptors are called chemoreceptors. Chemo indicates chemicals, right? So those receptors will be activated by what? By the chemicals, not by the pressure. They don't care pressure, okay? They are not sensitive to the change of pressure. They are sensitive to the change of chemicals. What chemicals? The carbon dioxide and oxygen. You know that if carbon dioxide and oxygen changes, that changes the pH of blood. And just know that the chemoreceptors are located where? In the same areas, and they are sensitive to the chemical changes in the blood. Which chemicals? Carbon dioxide and oxygen. Okay. So that is very important, because if the carbon dioxide increases in your blood, right, then what should happen? Blood should circulate more or less. The carbon dioxide should be taken to the lung more, to throw it out from the body, right? So, and remove the carbon dioxide from the body, right? And who will carry the carbon dioxide? The blood from the tissue. If just think that in your tissue or blood the carbon dioxide increases, more blood should run through the lung to release the carbon dioxide into the lung. Okay, so the blood pressure should be increased, and also the heart rate should be increased. Okay, so those are the regulations of the blood pressure, control of the blood pressure. Another type of cardiac centers are located in the brain. Those are called higher brain centers. Those are not vasomotor centers. Those are higher brain centers. Where they are located? They are located in the cerebral cortex and hypothalamus. So, the higher cardiac centers are located in the cerebral cortex, and hypothalamus. And vasomotor centers are located in the medulla oblongata that we have talked about, okay? And higher brain centers have controlling functions on the vasomotor centers in the medulla oblongata. So higher brain centers can send signal to the vasomotor centers and tell them to do their work. How to do their work. Okay?
To change blood pressure.
Yeah. So hormonal control. Which hormones help in controlling the blood pressure? Adrenal medulla hormones, epinephrine and norepinephrine, also called what? Adrenaline and noradrenaline. Have you heard that?
Yeah.
You have heard more adrenaline, noradrenaline, same thing. Adrenaline is epinephrine, noradrenaline is norepinephrine. Okay? And you know that adrenal gland, located where?
Near the kidneys, isn't it?
Adrenal gland is located where? Top of the kidneys. Okay, very good. So this is adrenal gland, and adrenal gland has, we have talked about this before in MP1. Adrenal gland has two areas. Outer part is called the cortex, and inner part is called what? Medulla. So from the adrenal medulla, epinephrine, norepinephrine, adrenaline, noradrenaline, those hormones are released. Okay. Now they increase the blood pressure. You know that when you watch the movie, I told you before probably, when you watch the movie, sometimes you will see on the DVD box, they write like, this movie has a lot of suspense, it will increase your adrenal release, adrenal pump, something like that they use. Okay, it will increase your adrenaline pump or secretion. That means it will increase the blood pressure. When you get excited, your blood pressure increases, right? Sympathetic drive increases. So how the adrenaline, noradrenaline work? They work by activating the sympathetic branch of autonomic nervous system. And you know that sympathetic activation will increase the blood pressure. Okay, I told you before, sympathetic activation means you are excited, right? And parasympathetic, you are relaxed, you are watching golf, I told you, right? So sympathetic activation is increased. Angiotensin 2 is a chemical that causes vasoconstriction. It will constrict the blood vessels and will increase the blood pressure. Okay? You know that how to increase the blood pressure, right? If you can increase the cardiac output, the blood pressure will increase. If you cause the constriction of the blood vessel, the blood pressure will increase, right? So the epinephrine, norepinephrine, they do both. They increase the cardiac output, force of contraction, directly work on the wall of the heart, and also cause the vasoconstriction. In case of angiotensin, it will do only what? Vasoconstriction. Angio means what? Angiogram. Have you heard angiogram?
Veins.
Yeah, blood vessels. Right? So angiotensin. Tensin indicates tension. So it will increase the tension on the blood wall of the blood vessel. Will increase the blood pressure. Angiotensin. Okay. Now, angiotensin 2 is the active form of angiotensin. Angiotensin 1 is inactive. So angiotensin 1 is what? Inactive. It will not work on the wall of the blood vessel. It will not cause the vasoconstriction. Angiotensin 1 is produced in the kidneys. Your kidneys produce angiotensin 1. The angiotensin 1 actually the kidneys produce a chemical that is called renin. Okay, and that renin will convert the angiotensin 1 to angiotensin 2, which is the active form. Okay, so renin is produced by the kidney that will activate the angiotensin and will produce the active form of angiotensin, which is the angiotensin 2, and that will cause the vasoconstriction. another chemical that is called renal natriuretic peptide. Renal natriuretic peptide that causes, it will work, atrial natriuretic peptide, it will work on the blood vessels, and this chemical is produced in the wall of the atria. That's why it is called atrial natriuretic peptide. In the wall of what? Atria of the heart. This chemical is produced, and it causes generalized vasodilatation. That means everywhere it will cause dilatation of the blood vessel. Now, if the blood vessel is dilated, the blood pressure will go up or down? Down. Constriction will cause increase, right? Dilatation will decrease. So, ANP, atrial natriuretic peptide, we also use the term ANP, that causes vasodilatation and decreases the blood pressure. Antidiuretic hormone, or ADH, that is also called vasopressin. And antidiuretic hormone works in two different ways to change the blood pressure. If you just think its name, first, antidiuretic, it will preserve the water, right? Will reduce the production of urine. Diuresis means urination, okay? So antidiuretic will decrease the urine volume. So the volume of blood will increase in your body. Make sense? By reducing the production of urine, antidiuretic hormone will increase the blood volume, right? And we know that if the blood volume increases, the blood pressure will increase, because that's the direct factor, right? Influencing factor. That is one. Antidiuretic hormone, when it was first isolated, we didn't know, the scientists, they didn't know for a long time, it works on kidneys and prevents the production of urine. They only knew that it causes the constriction of the blood vessels. When they first found that chemical, they found that it causes the constriction of the blood vessel. That's why it is called vasopressin. They named it vasopressin. Pressure, causes pressure on the, presses the blood vessel. Okay? Then they found that no, it has even more powerful action on the kidneys and reduces the production of urine. And that is more prominent action of antidiuretic hormone. Okay? So by two ways, this hormone can change the blood pressure. Increasing the blood volume, increasing the pressure on the wall of the blood vessels. Aldosterone is produced by the adrenal cortex. You know, the outer part of the adrenal gland is the adrenal cortex, and aldosterone is the chemical produced by the adrenal cortex. Okay, and aldosterone causes what? This is interesting. Aldosterone works on kidney tubules, on the nephrons. You know that kidneys are filled with nephrons, the tube-like structures. Okay, so this is a nephron or kidney tubule, and aldosterone works here. This part of kidney tubule. We'll talk when we talk about the urinary system. Just know that aldosterone works on kidney tubules or nephrons and helps in reabsorption of sodium. Reabsorption of what? Sodium. Anything inside the nephron or kidney tubule that will do what? That is urine. That will get out from the body as urine. Anything remains in the kidney tubule, that means it is urine. Now, reabsorption means taken back where? Into your body. From the tubules, sodium will be taken back into the body. Okay? From where? From the urine, right? We can say this is urine because inside that nephron is the urine. It will get out from the body. So, sodium will be taken back into the body by aldosterone. And we know that sodium, probably you know that if someone has hypertension, high blood pressure, doctors tell not to eat what? Salt. Salt is what? Sodium chloride. Sodium chloride. And why they ask not to take salt? Because sodium can hold a lot of water molecules. Okay? So if sodium goes back into the body from the urine, it will take what? Water molecules with it, right? So the blood volume will go up because sodium is going and water is also going back into the body. Okay? So that will increase the blood pressure and decrease the urine formation. Is it clear?
Yes.
Okay, good. So you see so many ways, right? Your body is trying to fix the blood pressure, to keep the blood pressure constant, unchanged, without changing. Okay? Just know that renin helps in the production of angiotensin 2. Okay? And that causes the vasoconstriction. That's the main action of angiotensin. Angio is the blood vessel, tensin is the pressure on the blood vessel. Okay? Angiotensin 2 also increases the secretion of aldosterone from the adrenal cortex. But you know how the aldosterone works by reabsorption of sodium, and sodium will take the water with it. Okay? So that's how the blood pressure is controlled. We are done a little early. That's good.